Let's say I have chemotherapy and radiation therapy on the same day. We're not going to put those 6 hours apart because then what are you supposed to do in between the two? So instead, we try to make sure that they'll be, let's say, 30 minutes apart.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest today is André Diamant, CEO and co-founder at Gray Oncology Solutions. André, always good to see you.
Likewise, thanks for having me here again.
Let's just start by hearing your pitch. Where are you at with Gray OS? By the way, I love the double meaning of operating system and oncology solutions there. Where is Gray today?
Yeah, so we're a company that started up 4 years ago or so, kind of really right at the start of COVID. And the focus was, can we build a software that will interface with the existing softwares in a cancer center and really optimize, orchestrate, and automate cancer care logistics? So concretely, that means scheduling all the different appointments, whether it's infusion therapy, radiation therapy, lab work, pharmacy, you name it.
Okay, so why cancer? Let's put a face on the challenge of the complexity of a patient coming through a cancer center.
Yeah, one of the major elements about cancer is because there are so many different pieces to that puzzle. There's so many different silos, for lack of a better word, that they have to move through. Often those can be operating relatively independently of one another, even though the patient is at the center of it all. And from their perspective, it's their cancer treatment. It doesn't necessarily need to be separate, even though, yeah, sure, it's in multiple different buildings or locations. We're trying to really bring that together and make it feel like one seamless experience, both for the patient and also for the operational folk.
Okay, so how do you do that? What does it look like on the patient side and on the physician side?
So right now, the patient actually doesn't necessarily use the software. The software is more provider-facing, and then it's anybody who's doing any sort of scheduling or resource allocation uses our software. Basically, it's a web app that links directly to their existing software, and it will determine what is the optimal time, date, you name it, for this particular treatment or intervention.
Okay.
I say treatment, but it could also be imaging. And then when the patient has that sort of relayed back to them, they're confident that those appointments are optimized in terms of delays. They're close together. So let's say I have chemotherapy and radiation therapy on the same day. We're not going to put those 6 hours apart because then what are you supposed to do in between the two? You can't really go back home or to work. You kind of have to wait at the hospital. So instead, we try to make sure that they'll be, let's say, 30 minutes apart. So there's enough time for a bit of a buffer, travel, or transition between one area of the hospital and the other. But at the same time, they don't have to necessarily be there all day. So it's like the little nuance like that then kind of moves into the patient realm of improving their experience and hopefully reducing stress.
Interesting. So you mentioned one use case, which is like, I don't have time to go home and come back for the next thing. What are some of the other sort of complexities that you factor into the system?
So on the patient side, their location in terms of where they live. Some cancer centers will have multiple physical facilities, so we can account for the distance from those facilities. So if a patient has to travel an hour because they have no other option, we're not going to book them at 8 a.m. because that's too early. So they'll be more kind of hard locked into, let's say, the 10 p.m. to 2 p.m., 10 a.m. to 2 p.m. slot. So little things like that. We also take into account patient preferences, literally. So if a patient says they prefer this time, it will do its best. Of course, we can't necessarily work magic. Lots of people want to avoid rush hour. We can't make them all avoid rush hour. But at the very least, when you have 100 appointments that you're booking in the day, tons of different constraints, some of which are hard constraints, like patient physically can't get there in time or is out of town, some of which are just preferences, all of that kind of feeds into the software to spit out, hopefully, a solution that is optimal for as many people as possible.
I'm guessing the old standard of care was pretty manual. I'm just imagining like calling in and saying, I'd rather have my afternoon session versus the morning. Is that the case? You're replacing pretty manual operations?
Yeah, so it's often done on a calendar. So, they have a literal calendar. It's usually a digital calendar, like a Google Calendar, inside the existing software. But the level of automation or optimization of that is very minimal. So, as you said, it's very manual. And then day to day, as things happen, you have to make adjustments on the fly manually. So, and at that point, you already have 100 patients being treated or coming in and out, and maybe you're already delayed or a nurse goes home sick or what have you. And trying to piece through that sort of daily chaos and still maintain the operations as you want them to be can be difficult. And that can cause delays, waste resources, so on and so forth. So one of the areas we provide is that real-time element where as things happen during the day, you can just immediately sort of re-optimize the schedule and see what does that do.
Interesting.
Now what do I do? How do I shuffle things to keep things moving as quickly as possible?
Interesting. Okay, so you started this company 4 years ago, around the COVID era. You kind of birthed out of that. I'm sure those first couple of years were challenging. Kind of what have been the recent milestones and kind of what's growth looked like recently?
Yeah, so we were fortunate right when we kicked off to partner with the hospital, University Health System in Quebec, and that really let us build the software inside a real clinical environment. Since then, we've begun to expand into other provinces, just about to expand into the States. We're now in 6 hospitals, about to deploy in 2 more. So that'll put us in 8 different hospitals, each of which has their own kind of nuances. Along the way, we've raised a couple rounds of financing, built a number of different partnerships with both software vendors and other sort of nonprofit organizations. And now a major area that we're improving the actual software itself is by introducing some I say real AI, but some more machine learning, more traditional AI that most people would think of when they hear the word AI.
Okay. What is one of the biggest challenges of breaking into the U.S. market? You said you've worked with a number of Canadian hospitals.
Yeah. So they're different environments. There's a lot that's similar, but there's lots that's different as well. And what that then translates to is us building up our credibility. Obviously, healthcare is a market and just an environment where it's fundamentally relatively risk averse. People, rightfully so, aren't going to put their patients or their staff in any sort of risk.
Yeah.
Whether not necessarily harm's way, but in risk of adding more burden or stress. So that can make it challenging to integrate a software like ours into a new market when we're a company that doesn't necessarily have much of a name. That's just keeping it real. We're 4 years young.
Yeah.
So and our so far our success has been in Canada. But the thing is, what we do and the challenges we solve aren't unique to the Canadian ecosystem. So what we've been trying to do is sort of build out that product, build a mature technology team, and show that it works in a Canadian side of things, and then translate how it works directly to the American side. Yeah. And of course, that's always an ongoing work in progress. We believe now that we're at the point where we've sort of reached a level of credibility that will let us truly enter the market and enter hospital systems. But it's been a marathon.
Yeah. You're at an interesting, inflection point at 4 years where you're building your team, you're building the brand, and you're building yourself as a CEO and founder. So I'm curious, since a lot of the folks who watch this and are part of Startup Health are also CEOs, kind of what work are you doing on yourself to kind of be the CEO that you want to be for your team?
It's funny because this year especially, I wouldn't call it a New Year's resolution, but for some reason, the word deliberate has really kind of come into my vernacular as something I'm focusing on this year. Okay. And many members of my team make fun of it now because it's like a broken record. I say it all the time. And everything comes back to it, and it's the idea of just no matter what you're doing or what decision you're making, be deliberate about it. And even if it's the lack of a decision in itself is a decision. So if you're choosing not to do something, you're choosing not to travel to this conference or build this feature or spend this money on a marketing campaign, whatever, just make sure you not doing that is just as deliberate as what you are choosing to do.
How do you see yourself applying that to your own life? I know you have kids and family. You're trying to balance that against startup life.
Yeah, it's on the personal side, it's being deliberate to take time for my family and not get fully drowned in being a CEO, which is totally possible. It's very easy to just get consumed with the nonstop work. And even when you're not doing physical work, having your mind sort of drift into work mode where you're thinking about this or that. So I try to be very deliberate about protecting that time.
Are there actual practices that you've woven into your life or your work to make sure that happens? Or is it just a filter you're just thinking about? Was this deliberate or wasn't? Or have you built in any practices?
On the personal side, I think it is just having scheduled time slots almost helps. Sometimes that's extracurriculars, like we do swim lessons every Sunday morning, and I go to them every morning, and I'm going to go. I'm going to keep going. Yeah. I never, even though I may be very busy, I don't miss one just because I had to work. I'll figure it out.
It's a priority.
Ideally, I'm more proactive, and I try to never get myself in that position where I feel like it would be stressed, but I'm going to go to swim lessons with my kids.
That's good.
On the work side, it's still a work in progress in terms of I don't want to overstructure it, but it does mean like whether it's me or somebody else coming to me to make a recommendation. If we're brainstorming, that's fine. But if you come to me trying to make a recommendation to spend this money or not spend that money or whatever, come with it prepared and clearly thought out. And as I said, deliberate in terms of here's the reason why I think we should do it. Here's why we shouldn't. Here are the assumptions that I'm making. Here's the ones that are unknown. Here's the things that we're taking a chance on because we honestly don't know, but we can't just sit around doing nothing. So we have to make a choice.
Yeah.
And I'm trying to kind of foster that culture on a professional level where everybody feels empowered to come to me or come to whoever they work with an idea, no matter how bold it is, as to what we should do moving forward. Yes. And I'm not speaking necessarily as broad, but even if it's as little as, we're planning a webinar, who should we invite? Like even something like that, just think that through specifically. Write down the thoughts, write down the reasons, and then we can talk about it as a group. But trying to have fewer choices that are made kind of shooting from the hip, where you're kind of relying more on gut, which I realize has its value. Sometimes you just have to. Sometimes you don't have time to write everything down. You just got to make a decision. Yeah. But if possible, I want to minimize that.
Yeah. Graduating out of that phase into a new phase.
Yeah, which hopefully it doesn't backfire in terms of a culture that people find more annoying. Yeah. But it's had success so far, and I think a lot of our team appreciates it as well because it makes them feel like they have more ownership over what they're doing when they bring an idea to the table and they know that they can defend it. And I'm going to be that devil's advocate or obnoxious person who's going to drill them on that idea and they can defend it. That's good for everybody.
Got it.
And good for the business as a whole, because at the end of the day, you're probably going to come to some level of optimal solution because of the thought that was put into it.
Okay. What are you most excited about for the next 12 months in terms of business, milestones, partners, et cetera?
I think there's a couple that are related, but it has to be the American expansion, us really getting boots on the ground in the States, beginning to build more credibility here and learn the nuance, because I know there's going to be some turbulence. There's going to be things that are a bit different. Billing obviously is way different here than it is in Canada. So adapting the software to do that, we believe we will succeed at that. And then in parallel to that, we are now entering a relationship with a software vendor on the lead generation side of things to basically work with them, approach their customers together to deploy our software where they are already deployed.
Interesting.
And certainly the hope there between both parties is that it'll lead to a fruitful collaboration. So.
Whenever I'm interviewing someone who's bringing a technology from another country to the U.S., I always think of it as like a superpower because they're seeing our system with outside eyes. Are there ways in which you feel like you're bringing something really unique and important to the U.S. market because of a Canadian perspective?
I think so, yeah. Maybe. So Canada is at capacity pretty much always. That's the reality. There's way more demand for healthcare than there's supply. Whereas it's a bit different in the States. You have more facilities that can treat patients. Of course, there's the economics challenge to the whole thing, but fundamentally there is more available capacity. What that means, though, is that in Canada, we were almost forced to build something like this that is really pushing the limits and squeezing out more capacity out of a drowning system. The American system, we want to show that you can still squeeze more out of it, and hopefully that will kind of flow down and just increase access to care overall. And make the systems that are at capacity maybe a bit less at capacity, spread the load a little bit more across the environment, and just ultimately reduce patient delays.
Love it. Andre, it's always great to check in with you. It's awesome to see how you're growing as a CEO and a founder 4 years in. Amazing partnerships coming to the U.S. So we'll be excited to watch what you do in the next 12 months.
Absolutely. Thank you.
All right. Thanks, Andre.